You tuned into this video because you want to find out how to pass your LPN NCLEX. Is it easy? No. Is it hard? Yes. But let's make a solution to make it easier to pass. What's up, munchkins? It's your girl Old Donuts and I'm back with another video. Now in today's video, once again, you guys can call me Osa because it's the professional side of the channel. If you're a reoccurring or new viewer, just know I have a whole playlist called Nurse O dedicated to just me making nursing videos and just my LPN/RN life. I'm currently an LPN, but I am in school going for my BSN. Let's hop right into the video and let me tell you guys my best tips and tricks on how to pass your LPN NCLEX. It doesn't matter if this is your first time taking the exam or when you've taken the exam and how many times you've taken the exam. These tips will apply to first-time exam takers, those of you who are retaking the exam, and those of you who are looking to prepare for both the old and new NCLEX board exam. When you walk into a job interview, you're not going to be asked how many questions did it take for you to pass. So we're just looking to pass here. We're not worried about 65, we're not worried about 205. We're here to pass. People fail to realize that the NCLEX doesn't want you to be the most intelligent nurse, although that would be great, but it's just not realistic. The NCLEX is making sure that we are amongst the safest group of nurses. They want to produce safe nurses. We're gonna start off with the basics. Tip number 1, give yourself enough time to study. You guys, I cannot stress this enough. Make sure you give yourself enough time to study for your LPN board exam. Me, I messed up and I ended up taking my board exam months after graduation. And if you don't use it, you lose it. So a lot of the information that was secondhand nature to me, I just started losing it because of the fact that I wasn't rereading my material. That gap in between graduation and taking your board exam can either make you or break you. So enjoy life after your board exam. It's so important to develop a routine for when you want to study and the specific topics that you will be studying for that week. Next tip, choose your main knowledge-based resources. Now, when I say knowledge-based resources, one of the biggest resources, and I think almost every nurse says it in their video, is using something like Uworld. Uworld is great because it covers all areas of nursing. It covers fundamentals, health assessment, maternity, peds, and all of the bodily systems. I used Uworld to pass my exam, and one thing I know that for sure helped me was doing 100 practice questions a day and really making sure I understand the rationales of the questions. With questions you get wrong, I would recommend that you rewrite the question, understand the rationale, and expand on that specific topic/area. Now, Uworld is great for your practice and test questions. However, you want to use something so that you can expand on topics because Uworld is not a textbook. Sorry guys, my camera died on me. I like to expand on questions using Saunders, Kaplan, and ATI. I get a lot of questions on whether ATI or Kaplan is a better resource. Now, I've used ATI with my LPN program and I'm using Kaplan currently with my BSN program. In my personal opinion, I feel like Kaplan questions are more styled towards the board exam. I think ATI questions can be a bit harder, or maybe just it seems like the ATI questions are harder because of the way they present the questions. And even my ATI exit exam, I didn't do too well. I passed it. However, it was like a really low passing score, and you know, you get stressed out and you think, okay, with this exit exam, it's predicting whether or not I'll pass my board exam, and it basically said I'm gonna pass by the skin of my teeth. However, I'm pretty sure I did pretty well on the board exam because I passed, and I passed at the minimum. Another resource to gain information I would recommend for my visual learners, Klimek Lectures. I never used them, but my sister used them and she says that they worked wonders. Next tip for preparing for the NCLEX, I recommend breaking up the bodily systems and subjects and studying them in one setting. What I mean by this is having a game plan. So if you want to split 3 days and specifically study 3 days of cardiac, spend those 3 days just studying cardiac, and then the next 3 days you can do endocrine. Breaking up the topics will allow you to pinpoint your strong and your weak points. You don't want to mix everything together and you're not sure if you're slacking in peds or if you're slacking in maternity. Just make sure you're breaking everything up and you're knowing the medications that's within that system or subject. Next tip for preparing for your board exam, make sure you're re-reviewing your worst subjects. The board exam wants to make sure you're a safe nurse, and if they see you're slacking in peds, they're more than likely to give you more ped questions to make sure that you're competent in that section. Now, I say peds because my least favorite subject was peds. that 2.2 divided by blah 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 pounds was not for me. Breaking up the topics allowed me to realize that, hey, my exam scores are lower in Uworld's pediatrics section versus med-surg. So at least 2 weeks before your exam date, make sure you're re-reviewing the subjects that you are least competent in. My last tip, which really isn't a tip, but is just some information for those of you who are preparing to take the new generation NCLEX, it's the question format. I was lucky enough to have a feel for the new NCLEX styled questions because I took a Kaplan practice exam where they basically gave us a sample of 30 questions of how the new NCLEX will be. And when I tell you, these 30 questions were a lot different from how the regular NCLEX is. But don't be scared of the new NCLEX. Yes, there's a different format in the way the questions are structured, but it's still the same information that you have to know. These last pointers are just some information on how the new NCLEX is going to style their questions. First, the NCLEX is introducing extended multiple response, which you will receive partial credit for. I'm glad that the NCLEX has considered giving partial credit instead of us getting an entire question wrong. 2, extended drag and drop questions. 3, closed option questions. 4, case study based questions. Now with the 30 questions that was sampled to me by Kaplan, I received a bunch of case study based questions, and basically I received a patient with a specific disorder or disease, and I was supposed to highlight key factors within the case study that needs to be reported to the healthcare provider or that needs further nursing intervention. And I do believe you're receiving partial credit for the case study questions. And lastly, 5, matrix grid questions. Now if you guys want more information on the new NCLEX and how the questions will be formatted, I'm gonna leave a link below for a nurse in the making. She does a great way in explaining how the new questions will be formatted, and all of the new form of questions are pretty similar to the old format. The newest thing I think is the case study questions. And remember guys, don't stress with the new generation NCLEX because it's still the same material, it's just being presented to you in a different way. Now, one way I found out that I passed right after my board exam, although after I finished my board exam I was very confident that I passed, you can do the little trick. I know you guys have heard of it. You can go back to NCSBN's website and try to register for another exam. Now, supposedly, if the site allows you to register for your NCLEX, it's because you didn't pass. However, if the site is not allowing you to register for your exam, it's because you passed. Good luck to all of my new nurses. I hope you guys pass your LPN board exam. It doesn't matter how many times you've taken the board exam. Just take it, pass it, get it over with. Don't forget to like, subscribe, and comment. And comment what date you graduated from your LPN program and when you plan on taking your board exam. I wish you guys nothing but the best. Good luck. Don't stress it. You got this. Love you guys. Bye. Make sure you get some rest the night before your exam.